Well, so to fix our current healthcare system, there are some things that the federal government can do. One of the things that they can do is, number one, stop the punitive lawsuits. Now, all the ones that are at a federal level, the federal government does have the ability to stop those. Now, it's putting caps on the amount of non-economic damages. Those kind of things could be done. Now, when you look right now at the trial, I was on Fox a little while back, and Eric Cantor was on there, and they had a couple other guests on there, and we were talking about this. We were having a little panel discussion on what do you do, how do you fix the healthcare system, and why are the trial lawyers such a problem? And the Democratic Party in the last 10 years has received $1 billion. That's $1 billion in campaign contributions from trial lawyers. And Barack Obama in the last election himself received $46 million from trial attorneys. Now, this is the reason we don't see any kind of tort reform, any real tort reform in the country, or even being discussed, because the trial lawyers own the seat Barack Obama and half the senators and congressmen are sitting in, and they know it. So that's the reason, when you want to know why we haven't seen tort reform, I can give you 1 billion reasons why. And that's the problem we're having right now. But to bring costs down, we have to have, a system where doctors aren't terrified that a patient's going to come in and just, with a trial lawyer's aid and trial lawyer's assistance, and completely wipe them out. That is one of the things that makes medical care so expensive in this country. Because those trial lawyers, when they sue, the price of insurance has to cover those lawsuits. So the price of insurance goes up. So when you have, your John Edwards out there raking all kinds of money suing doctors, that's where the money's coming from. It's coming from us, and it's part of our insurance premiums. Another thing we need to do is stop right now a lot of states, they tell other states that you can't have insurers come in from outside and sell insurance inside our state. Well, the federal government has the right has a say in that matter. It's given to them by the Constitution. They can say, no, you have to allow trade across state borders. And right now, many states are stopping that trade. They're saying we have our own system in place, we have our own insurers who give contributions to politicians, and we're going to protect those insurers, and we're going to protect those groups, and we're not going to let outsiders come in and drive the price down. That has to stop. The federal government needs to tell states, this is one of the appropriate roles of the federal government, is tell those states that you have to allow trade across borders. That's something our founders envisioned as something that we would do in this country. Tennessee can't tell North Carolina that your citizens can't trade across our border. That's something that they put in place for a good reason, and we need to respect those kind of founding principles that we have and use those today. Thank you.